Hi guys, we are from the Medical Cross team and today we will be showing you how to save someone's life. If you're walking by and you see somebody unconscious on the floor, the first thing that you have to do is CPR, whether no matter where the situation or the setting is. So that's what we're going to teach you right now.
So, disclaimer alert, some parts of our presentation here may not be as prepared because we were all busy to prepare. So at some points maybe you'll see us holding our phones, trying to recap what we're supposed to do. So, oh look, the patient. Hey, you're unconscious. Don't laugh. Okay, let's do CPR.
Hello guys, so Faris will be our medical assistant and Ikmal is going to be our casualty, and I, Aishu, am going to be talking through the process. Now we have Faris here lying down as a casualty. And the first thing when you see a person lying down like that is first check for danger around the person and only approach the casualty if there's no danger opposing to you. Now make sure you situate yourself at the right side of the patient, because the patient's heart is on the left side and it will be easier for CPR. Now try to hit the casualty and see if they are awake.
Are you awake? He's gone. What
Right.
to do?
If not, the first thing you have to do is call an ambulance, and while waiting for the ambulance, that's when we are going to perform the CPR.
Hello? We have a casualty here at Costas. Yeah, please come quick. Thank you.
So now Faris is on the right side of the casualty. He's going to check for a pulse. The pulse that Faris is looking at is the carotid pulse. Now we only perform CPR if there is no pulse present.
There's no pulse present.
Okay, now Faris is going to look for three things on the patient. Faris is looking for the chest movements of the casualty. Is there any hot air coming from the mouth of the casualty?
There's no hot air.
And also, is there any breathing sounds coming from the casualty?
No breathing sounds as well.
Alright, if all is absent, we have to start our CPR. The CPR, we started with external chest compressions and then 2 blows. I'm going to come a bit closer just to show you guys better. How do we locate where to do the external chest compression? If it's a male, we locate the nipple of the male and put 3 fingers beside the nipple and press a hand down. And then we put another dominant hand on top of that, and that's when we do our external chest compression. But what if it's a girl? You look for the tali pusat,
The belly button.
the belly button of the patient. Yes, and then you do that towards the left side, put 2 fingers in, and then do the same process as it is for the males. Right. Now how do we position our hands when we do external chest compression? Make sure we lock in the elbows so that when we are pressing in for the compressions, we don't bend our elbows. Faris, can you show us how to do a few chest compressions?
So first, get the position right. Lock your hands in, make sure they're both straight, and use your whole body weight to push onto the patient. So, go 1. And make sure as you push, the chest does come back up, but if not, that means the rib is broken, but still it can help save lives.
Yeah, so if the ribs are broken, it's totally fine.
So now, we have to do this for 30 times in a minute, and to the rhythm of Poker Face.
Can you sing it for us?
I can you?
Yeah, sure. Carrot my, no we can breathe in my poker face. Yep. So 30 of the external chest compressions in 1 minute. And then what we have to do is deliver 2 blows. And these blows are to ensure that we are giving in air to the lungs of the patient. So there's this technique called the head tilt chin lift that we need to follow. Can you please demonstrate it?
I need to cover his eyes first. This is uncomfortable for me. You're unconscious. Get up. Shut up. Okay, first you pull back the eyebrows along using this part of your hand, and you cover the nose, and you pull the chin. Open your mouth. Thank you. You're very cooperative. Up. Then you blow twice. Then you get back to the ECC.
Yes. And when you're blowing, make sure you look at the casualty's
Oh,
chest
yes.
and see if it's rising up and down.
First, you pull back the forehead. You close the nose. Pull the chin, and you blow twice. The first blow. Then you see if there's any movements, and if you hear any airflow. And do it again for the second time. Do the same thing. And if there's still no sign of life, return to the ECC and back to the head too.
Yeah, so we have to continue doing 30 external chest compressions and giving 2 blows until there's 3 situations that's arising. Number 1 being you stop if you get tired.
Tired. What's the second part?
Number 2, you stop if the paramedics arrive because then they will take over for you.
Oh, look. They're not here yet.
And number 3, you will stop if the patient regains consciousness.
Wake up. Wake up.
I just wake up. Okay guys, thank you for watching and don't forget to vote us. We are from, what's our group name?
Medic.
Cross team.
Medical Cross Team. Okay guys, bye.